What is it about hypertension itself that makes it so impactful? Do we know anything about maybe
That's a phenomenal question, and the short answer is we don't know. There's multiple. I have multiple different hypotheses on this, and I think the overall hypothesis is so. One is it could just be that having two diseases is worse than having one disease, right? And there is some evidence that, where some of the previous data um, on comorbidities said the more comorbidities you have, the worse you do as well, and certain cutoffs that they did if you have three or more or things like that. Um, and so it is possible that honestly, just this is a marker for people who are more sick. They have two diseases, they have three diseases instead of having one disease. And if you have two or three diseases, you do worse than if you only have one disease. And that kind of makes sense. But there is also a body of literature, especially within the hypertension literature outside of MS, that shows overlaps with MS. So we know that hypertension leads to arterial stiffening and fibrosis and things like that. And they now know that that process is inflammatory. And many of the pro inflammatory signals related to hypertension have evidence of pro inflammatory signals in MS. And there I think there's a very real question about whether, and that's kind of true in diabetes, which is a pro-inflammatory, and metabolic syndrome is pro-inflammatory. And so I think there's a very real possibility that these comorbidities, including hypertension, are in fact pro-inflammatory and actually worsening the pathophysiology of multiple sclerosis, but that is not proven yet. And so we don't know.
so um I'm always talking about inflammation, which is it's not my special interest, but I was just talking to some dietitians from Australia actually, and we started kind of talking about inflammation and anti-inflammatory diets later on in the conversation. This is something that we hear across specialties every time, from neurology to oncology. Like there's always kind of this idea of yes, and inflammation exists. Um, I'm wondering when I think about the future of medicine, especially like getting more precise and personalized, what I'm finding is with my conversations with doctors across specialties is that there isn't a lot of interspecialty conversation and connecting of the dots. And when we look at things like epigenetics, for instance, I'm thinking specifically when people take use machine learning to look at past clinical trials and past research and what have you, some of the insights that are being found are really building a picture of this multidimensional view of any one disease, right? Uh, so when it comes to collecting data and thinking about how that data might be used in the future to pick up some insights to help us better understand diseases, is that something that you're thinking about when you're collecting data? Is that a conversation that's being had in this world?
So I think there's a couple of things there. One, we always have to be thinking about how data might be used in the future, especially when we're doing prospective studies and you actually have to consent for whether or not you can use someone's data in a different way in the future and things like that. So people are trying to think of like, okay, how else can we use this data? Especially the more and more we get into quote unquote big data and AI and like how can we actually use these large databases to improve health and improve medicine. But I hear you, and I think that you're spot on in that there's not enough collaboration across specialties. Um, and there's a lot of reasons for that. When I was in medical school, a paper came out that actually just looked at the number of journal articles that were published in a year in medical journals, and then looked at the average time spent at work for a doctor, and they basically showed, and I think they looked at the average reading speed as well. And they basically showed that it was impossible for any one doctor to keep up with all of the published medical literature, even if they did that as their entire full-time job and never saw a patient. They would not keep up with all of the medical literature. And so the result of that truth is that we're becoming more and more hyper specialized, because while it's impossible for me to keep up with all of neurology, it is possible for me to keep up with neuroimmunology and multiple sclerosis. And so you get these more and more specialized people. But as I get into my individual research and looking at comorbidities and hypertension and health disparities, the more I joke, the more and more subspecialized in neurology I get, the closer I get to becoming a primary care doctor instead of a neurologist. And there is that overlap. And I think in the future, we'll have multiple hyper specialized individuals collaborating to recreate that generalized knowledge that we used to rely on.